8 years ago, Greater Manchester had some of the worst cancer outcomes in the country and in Europe. This is both for survival and in some elements of experience. So what we've been able to do with Greater Manchester Cancer and the team is over time transform those outcomes. So now, currently, our survival has been improving by 30% faster than the England average, and we're now diagnosing patients much earlier than we did before, 2% higher than the England average now for survival. So the joint approach we've taken in Manchester is to bring the whole system together. So service users, we've got at least 100 active patients involved in all elements of service design and service implementation, a lot of transformation, a lot of new ideas and projects to try and transform things involving GPs and hospital services. And we've also been part of the National Cancer Vanguards, who have been setting the national agenda. This has all come together because of a really good team that we've got in Greater Manchester Cancer. People, professionals, service users who've come together around a single idea of getting those outcomes better. And that has made a real difference.
There is much more to do for our patients. We want it to be the best experience for patients. We've got a number of initiatives in Greater Manchester to help with those pathways, to speed them up for patients. They include best time pathways that are designed to concertina some of those diagnostics to involve less appointments for patients and quicker access to diagnostics and ultimate diagnosis. There's another programme of work that we are leading on in Greater Manchester, and that's called RDCs, or Rapid Diagnostic Centres. The nature of that programme is to look at symptom-based rather than tumour-based cancer diagnosis, so patients that fall into a vague symptoms category. And it's an expedited pathway that's focused on 1 or 2 days to reach the point of clinical diagnosis or exclusion of cancer. So it allows us to look at the patient holistically in that environment, and it's demonstrated so far that we've been able to vastly reduce the time to diagnosis or exclusion of cancer through this methodology. The patients think it's great. We've had some lovely comments back saying that it's a fantastic experience if you have to go through it, to at least have an outcome by the sort of the second day, to understand just what that means for them.
We recognise that when you get diagnosed with lung cancer, invariably patients have got very advanced disease because the symptoms don't present until late. So the lung health checks risk stratify patients, so that means that if you've smoked and you've got certain risk factors, you'd go and have a CT scan. The pick-up rate for cancers was massive, it's 1 in 33 scans. So we knew that we could pick lung cancer up early. By treating lung cancer early, patients could be curative, and that's not something we often talk about with lung cancer. The reason the Lung Health Checks programme is so important is every alliance across the UK, every person who provides cancer services saw this as a complete game changer. And across the UK now, with our long-term plan for cancer, the National Cancer Team have took the Lung Health Checks programme on, something that was led by Manchester, and it's now been rolled out across the country.
Smoking's a massive issue for us in Greater Manchester. It's the leading cause of cancer, and it's something that we really need to tackle. We've got some of the highest rates of smoking across the country in Greater Manchester, and this CURE programme is going to hopefully be the answer to unlocking that. So the figures are really great. So if you look at a recent national report, much less than half of patients are offered any help to stop smoking when they're admitted, whereas at Wythenshawe, our lead pilot site, it was over 90%. And that's transformed outcomes really quite substantially. So the number of smokers admitted to Wythenshawe, when we look at them having gone through the CURE programme 4 weeks later, a fifth have given up.
Prehab programme, obviously the fitter and the stronger the patient is, that's going to help me in my role in the post-operative recovery phase when they're in hospital, because they're not going to have had as much of a decline in their fitness and the strength as they may have had without the exercise programme. So that's going to mean we can get the patient up and moving much earlier, ready to start the next phase of their rehabilitation.
I think empowering, life-saving, I really do think it is life-saving. and brilliant.
It's not an innovative service if we don't have a patient at the front. The patients have a powerful voice, and that voice is important to be listened to. And when we do listen to them, we make some real innovative changes as a result. Programmes such as Prehab for Cancer, our Cure programme, our GATEWAYC programme, patients are at the forefront of that because they tell us and inform us about how we can improve things and make those changes that are necessary.
The patient has always got a voice, and we are listened to as well. And previously, years ago, health professionals just thought that they were in charge of people's health. I think people should manage their own health.
So obviously we can't talk about cancer, certainly in the recent past, without acknowledging the fact that COVID has very much changed the way that we've had to deliver cancer. So there's a huge priority right at the beginning in early April to make sure that we could maintain the most of our urgent cancer treatments that were required. We established a hub based around the Christie very quickly for our non-surgical treatments. But the challenge amongst our 10 surgical providers in Greater Manchester was obviously all hospitals were at different levels of escalation, different levels of critical care usage, different levels of theatre capacity. And so we had to apply a series of principles to both keep patients safe, keep surgeons safe, but allow us to continue to provide surgery for our most urgent cancer patients. I can say that we did that. We never stopped operating. Certainly NHS England were very interested and took on board much of what we had done in Greater Manchester in an adapt and adopt strategy for the rest of the country. So obviously in Greater Manchester we have GATEWAYC, which started out as a Greater Manchester educational platform for primary care, but has actually now been rolled out nationwide and has been very successful, certainly even pre-COVID. COVID and GATEWAYC have allowed us to actually get information out very rapidly to primary care, and we have used it to highlight pathway changes, highlight patient safety mechanisms, highlight the fact that we need to get our patients still into our cancer system. And what we've also been able to do is as we've had to change pathways and work in a very agile and new way in some of our pathways, it's allowed us to get that information quickly out to GPs. We've run a series of webinars about some of the changes that we've had to make. They've been really well attended. Over 500 people have been watching online, and we've managed to use GATEWAYC to educate and inform our population over the last 6 months with really good effect, and we've had really good interaction with primary care organisations around that.
So the Greater Manchester Cancer Conference, we've had a couple now. Last year's was our biggest, 2 days, 800 delegates. We had the Mayor there, the Cancer Research UK Chief Executive, a number of other dignitaries. But importantly, we had 50 invited service users and our frontline staff. And we came together around a number of themes in cancer, but it was a great vibe. It brought the whole system together around cancer. And we left with a number of great ideas and things to take forwards.
This Greater Manchester Cancer Conference is a really important gathering. I think I have watched what's been going on here, and you really get the sense that we're turning the tide on cancer, that this is beatable. And I'm not sure that was there 5 or 10 years ago. So things are changing. This conference is a really important moment where we all recommit ourselves to that fight. And I'm certain in time we will beat cancer.
Working as a system, Greater Manchester is unique in its approach. I've never experienced or worked in an environment where there are so many people all committed to the same cause, and I think that makes a massive difference for our patients.